Hello, this is Chris Ferrigno. This video discusses the anterior and medial compartments of the thigh. Before you listen to this, you may want to watch the short 15-minute or so videos for the hip and the knee joints. The next video in this lower extremity series will be on the gluteal and posterior thigh regions. For the anterior and medial thigh, this is the first of 3 smaller videos. In this video, the bony anatomy pertinent to the anterior and medial thigh will be discussed. Let's first discuss some basic nomenclature. The pelvis is comprised of 2 innominate bones, seen here, with the sacrum wedged in between them. The innominate bones can also be called the coxal bone or the hemipelvis. In this discussion, we'll be calling it the innominate, which means no name. The thigh is considered the area of the lower limb between the hip and the knee joints. The leg is considered the area between the knee joint and the ankle joint. And of course, the foot is distal to the ankle. In motion analysis, where I do most of my research, the leg is considered the shank, so I may say that once in a while. Let's start by looking at this radiograph. Here we see an innominate bone. At first glance, you may say that there's a fracture, say here, maybe here, here. But actually, this is a normal radiograph of a young individual. And so here, the innominate bone hasn't grown into place together yet. So we don't have a fully developed acetabulum, nor do we have a femoral head that's attached to the femoral neck. Let's take a closer look at the innominate bone. In this image on the left, the anterior segment of the innominate bone is here, while the posterior segment of the innominate bone is here. Anteriorly, there are 2 named prominences. The anterior superior iliac spine is at the far anterior reach of the iliac crest. Below that is the anterior inferior iliac spine. Arising off both of these are muscles of the anterior compartment. Off the superior one, the ASIS, is the sartorius muscle. Off the AIIS arises the rectus femoris, part of the quadriceps muscle. The interior concave surface of the ilium is the iliac fossa, in which resides the iliacus muscle. Also part of the ilium is the posterior superior iliac spine, which is in this area. This is also known as the PSIS and is palpable just within the dimple region in the low back. Inferiorly, we see the pubis and the ischium. The pubis is generally anterior, and the ischium is generally inferior and posterior. The pubis has 3 larger subcomponents, and the ischium has 2. Many of these subcomponents have more name structures that we'll name in the near future. Looking at the pubis, we can see the pubis has a main body, and coming off that body is a superior and an inferior pubic ramus. The ischium has a body as well. We would call this the body up in this area, and off of that comes a ramus. A posterior inferior extension of the body is called the ischial tuberosity. This is a very large bony prominence off of which arises several muscles in the posterior thigh region. Let's zoom in on the right-hand side so we can better appreciate these structures within the pelvis. So here we can see the ilium, and if we follow this ilial wing down, we can see where it merges into the pubic bone right here. So that's the demarcation line between the pubic bone and the ilium. So then this right here will be the superior pubic ramus, and right in this area would be the inferior pubic ramus with the pubic body right about there. We change colors and we'll draw the demarcation between the pubic bone and the ischium. And we'll see that right in this area. And then the remaining part of this is the ischium. So if we extend backward here, we're on the ischial ramus, and then up in this area will be the ischial body. And then of course the ischial tuberosity is a bit hidden in this anterior view. So the muscles which arise from that innominate will cross the hip and insert onto the femur. Proximally, there are a few key structures. The nearly spherical head of the femur articulates with the acetabulum of the innominate. It is attached to the femoral shaft, meaning the head is attached to the femoral shaft via the angled femoral neck. Laterally, off the proximal shaft, extends the greater trochanter. As you might imagine, this bony prominence is a point of attachment for many of the hip muscles we'll see soon, including several of the gluteal muscles. If there's a greater trochanter, there must be a lesser trochanter, and we see that here. We'll soon see this is a point of attachment for the iliacus and psoas muscles, i.e. the iliopsoas. Realize that femurs are not all created alike. This is particularly true in the proximal femur. Normally, the angle which the femoral neck makes with the femoral shaft is around 125 degrees. This angle is called the angle of inclination. An increase or decrease in this angle alters the stresses through the femoral neck and acetabulum, increasing the risk of femoral neck fracture and osteoarthritis within the joint. It can also affect the muscles that attach to the greater trochanter. These muscles will be discussed in the video pertaining to the gluteal region. Joints such as the hip, knee, and elbow are characterized to their angulation. The distal segment of the joint drives its designation. If the distal segment is directed towards midline, as we see here, it is coined vera or varus. If the distal segment is directed out away from midline, as we see here, it is designated valga or valgus. Here we see a hip with a more acute angle, which directs its distal segment towards midline. This would be called a coxa vera. If we see an angle that is more obtuse, like here, the distal segment is directed away from midline when compared to a normal configuration. This would be called a coxa valga. You may hear the term valga or valgum being used. Those are interchangeable, as are vera and verum. These configurations can cause functional impairments. For instance, a coxa vera may effectively bring up the femur, causing a limb length discrepancy, or a shorter limb here versus a longer limb here. Thus, someone may have a little alteration in their pelvis while they're walking from point A to point B. Also, a prominent greater trochanter, as we see here, may affect the action of the muscles that come and attach to it, because in this case they're shorter, and in this case the muscles have to be a little longer, so they effectively change their ability to fire. Being the longest bone in the body and serving as a weight-bearing structure, you can imagine the femur undergoes high amounts of stress due to the torque placed on it. This can lead to fractures, often at the femoral neck where forces are high. Fractures are extremely common in the elderly when bone quality diminishes and falls are common. In the younger population, fractures are more common during high-force trauma, such as falls from great heights or motor vehicle accidents. Often, fractures are repaired by plating and pinning the bones in place, sometimes due to poor bone quality or due to an osteoarthritic joint. The joint requires replacement. During this procedure, the femoral head and neck are excised. The acetabulum is reamed out and replaced with an acetabular lining, and then the femoral neck is implanted along with a ball on the top of that femoral neck. Many of the muscles that we'll see today extend down to the distal thigh or distal femur or across the knee joint and insert onto the proximal tibia. So we'll take a look at some of those bony structures. The femoral shaft expands into the medial and lateral femoral condyles. Here we see the medial femoral condyle and the lateral femoral condyle. These condyles are the bony structures which articulate with the underlying or inferior tibia. The femoral condyles have bony projections called medial and lateral epicondyles. Here we see the medial epicondyle, and right over in this area we see the lateral epicondyle. Medially, a second, more superior bony prominence is called the adductor tubercle. An attachment site for the adductor magnus muscle we'll see in the medial compartment of the thigh. These femoral condyles rest on the condyles of the tibia. The relatively flat table of bone is called the tibial plateau. Laterally, there is often a small ridge of bone called Gerdy's tubercle. You can see Gerdy's tubercle right in this region. This is a site of attachment for the iliotibial tract or iliotibial band. Anteriorly, we see the tibial tuberosity, which serves as an attachment site for the quadriceps muscles. On the right-hand side, we see two normal radiographs, a PA radiograph seen here and a lateral radiograph seen here, where we can better appreciate the interaction between the distal femur, or these condyles, here and here for the lateral and the medial condyles, resting on top of these tibial condyles, the lateral tibial condyle there, and the medial tibial condyle there. This concludes the discussion on the bony anatomy of the anterior and medial thigh. In the next video, we'll discuss the soft tissue structures, including the muscles of the anterior thigh. And then in the third video, we'll discuss the structures, including the muscles of the medial thigh. Thank you, as always, very much for listening.